Hey, what's going on, everybody? Redbeard Canada. Look like that thing coming gray, Canada. What's going on, everybody? Doing this DVT little cast, It's not a podcast, it's not a YouTube cast, it's a Relentless Dreams cast, you know what I mean? Positivity, everything behind it. Let's jump right into it, folks. What's the difference, between a DVT that's maybe an upper extremity or maybe like the lower extremity? Legs. So, you know what I mean? There's also other types out there, so y'all know, you know what I mean? So first one we'll start off is deep vein thrombosis, okay? Deep vein thrombosis is a clot that forms in a vessel inside the body, okay? It's deep, away, far from the skin, so you can barely see that the vein is there. So the parts that would become like the main part of interest on that part is like your pelvic, your whole leg, everything. So with that being said, that's like a little lower part. The upper extremity part is definitely something that plays a role as well. So just so you know, both upper and lower extremities can happen to anyone at any age. So I'm gonna flip my notes here. These symptoms can happen and can be caused by an injury, operation, the blood pool. The blood can pool and can clot, right? If you're in bed for a long time, if you sit for a long time, like on a plane or a car trip or just any type of trip, this can create the lower extremity issues, okay? Other things that can be caused by an upper extremity is having a device in the arm or the chest, like a catheter or something. Also, types of cancer can cause a upper extremity DVT. Sorry, I had to stretch out the jaw. Also, with a upper extremity DVT, they can happen to people who have a condition called Paget-Schroeder. I went over this in one of my other episodes. This right here is a syndrome which I explained earlier. Typically in athletes, they get that type of condition, or it can become that. Like baseball, swimming, tennis. When you do the same motions over and over again, that's where it kind of starts and elevates from. It's in the neck, shoulder area. It can be squeezed, like I have here, my my C5, C6. I have compaction from my car accident, but after trying to work out, do some things, it became tight, muscles real tight, so created, DVT, upper extremity part. Also, VTE, venous thrombolism. Excuse me. Big words. Redbeard Canada trying to make that happen. So your blood is made to clot. If it didn't, we'd all be in the emergency room. As soon as you cut yourself, either one is gonna clot, or it's going to basically like bleed out. So we're made for all that. Should this happen, just tie it tight, keep it tight, So we have DVTs, DVTUEs, PEs, VTEs, blood clots. VTs happen when the flow changes and slows down somewhere in some way, Also diseases, medical treatments, long flights, where your legs are stuck in the same position for too long. VTE can occur from that. Medical treatments, odd for VTEs to go up. If you're in the hospital for a while or surgery, like especially around the knees or the hips, cancer treatments, chemotherapy, definitely raises risk. Medications that could cause VTE, hormone replacement for therapy, birth control. So this is aimed towards women right there, just so you know. No flipper of the notes. VTE's risk is higher if you have cancer, lupus, or other immune problems, health conditions. Could make the blood thick, or even being obese. Sorry, got a call coming in. Gotta delete that for now. VTEs, if you're in an early episode of a VTE, it can constantly stay in the same position. If you're sitting for a long time, or if you have family history, smoke, or pregnant, or if you're even over 60, the chances go way up. Okay, those are for chances that go way up on a VTE. Venous, thrombolism. Diagnosis to rule out a VTE, doctors may perform tests called the D-dimer, which I've had that done. I get that done about every 6 months. So that's something that I work on a daily basis with my hematologist or oncologist, a cancer doctor. What's in the blood and determines the things that may be going on with the levels of the reading, okay? The D-dimer is just one of a few tests that could be done. They could do a duplex ultrasound, pulse oximetry, anterior blood. Oh my goodness. Arterial blood gas, so like your gastrals. Chest X-ray, VQ, which is a ventilation perfusion, spiral computed, tomography, just echocardiogram. VTE treatments could be blood thinners, surgery, clot busting drugs. VTE prevention, blood thinner, compression stockings, pneumatic compression devices, like a cuff that massages the blood flow up and down the leg and slightly squeezes, which I do have one of those. Try to break it out, see if I can't show y'all. Amongst other options to help prevent VTE clotting. The next segment I'm gonna go into, how to eat, what to eat, exercise, etc. I may reach out to my little brother who's a fitness nutritionist, see if we can manage something to tie him into the podcast or the cast, Relentless Dreams Cast, on anchor.fm/Relentless Dreams Cast. Make sure y'all go check that out on Anchor. If you ain't got it, download it, get it. But yeah, I'm here to spread this knowledge, man. VTEs, DVTs, DVTUEs, PEs, you name it. We need to get this out there. Lymphoma is the cancers behind a blood clot, which is everything I'm expressing and what I'm reaching out for to show on myself personally. But I want to spread the knowledge and love on, what could be done to help prevent a lot of this. Because young to old, man, we're catching it and it's having a problem. So elevate the legs. I'm going to try to reach out, like I said, to one of my favorite dispensaries and see if we can make something happen. Come together and get a little charity thing going to help out these folks in the cancer centers who may not be able to afford the chemotherapy if they want to do it, or the stockings, or whatever it be. So that's my goal, okay? So just keep watching, stay tuned, Hashtag every second counts. It's Relentless Dreams brand. I am Relentless Dreams. Make sure y'all reach out to me, IGFB, Snap, RD Brand 07. I'm all over the place, man. All over the place. I love y'all. Hashtag elevate the legs. Next segment, stay tuned. Ha! Red Beard Canada. Psh, almost gray. I'm out.